Magandang araw po, and welcome again to the overview of public health in the school setting. Now, we're going to have our second lecture, which talks about policies and programs in health. Again, I'm Dr. Michael Campued, the president of the Philippine Society of Public Health Physicians, and this lecture is brought to you by the Department of Education, USAID, RTI International, and PSPHP. So, within school health in the Philippines, it is concerned with the management and reduction of transmission of common communicable diseases, as well as the reduction of disability and risk from accidents and disasters. And added to this is the key responsibility of school health in the promotion of healthy behavior for good nutrition, mental health, and oral health. So in this particular slide, we're going to talk about the most common health issues in the Philippine schools. So first, the communicable diseases. Oftentimes, you have communicable diseases that deal with upper respiratory tract infection, gastroenteritis or diarrhea, skin conditions, and even dengue fever. There are also common accidents and injuries, which can be the non-intentional injuries like falls or scrapes and bruises, and also trying to detect violence and maltreatment among children. It's a common health issue as well to screen for non-communicable conditions, primarily those that are affecting the learning of our students, like, for example, visual acuity, hearing, scoliosis, malnutrition, and even hypertension. If we try to zoom into nutritional concerns, we can be talking about malnutrition in terms of stunting, wasting, being underweight or being overweight or obese, and certain micronutrient deficiencies. Another health issue can be clustered together as the oral health concerns. So these can be dental caries, toothaches, and those that we call periodontal diseases. And in terms of sanitation and hygiene, there are also those waterborne diseases and vector-borne diseases, which were also considered as communicable diseases. But in this particular situation, it's important to cluster them as well as hygiene and sanitation concerns. And we also have lifestyle concerns, which can talk about or can be the issues relating to fertility, sexuality, tobacco use, alcohol drinking, illicit drug use, and even excessive internet use. Meanwhile, there are also issues regarding reproductive and menstrual health concerns like early sexual initiation and menstruation. And of course, mental health, which can be talking about ADHD or attention deficit hyperactivity disorder and adjustment disorders, or even depression or learning disorders. So, when we look at these concerns, we are also in the understanding that these concerns have been mapped out and hence become the motivation for the Philippines to actually formulate a range of interventions or policies. So here in this slide, we're going to be talking about the relevant public health policies that are shaping school health as well. And strong policies for public health form a backbone for program creation and implementation to improve school health. So for example, we have the Republic Act 11223, which is also known as the Universal Healthcare Act. We understand that schools under the Department of Education are especially singled out as among the healthy settings and venues for the promotion of health literacy and healthy lifestyles, which is important within the provisions of the Universal Healthcare Law. We also have the Republic Act 10354, or the Responsible Parenthood and Reproductive Health Act of 2012. This is where the schools mandate to integrate age-appropriate and developmentally appropriate reproductive health education are integrated within the curriculum. So these are not limited, of course, to the topic in itself, but can be talking about values formation, teenage pregnancy, gender-based violence, and also responsible adolescence, among others. Another is the Republic Act 7610, or named as the Special Protection for Children Against Abuse, Exploitation, and Discrimination. So it seeks to safeguard children from situations such as abuse, human trafficking, and forms of violence. Another law is the Republic Act 8172, known as the ASIN Law. So the Department of Education is also designated as a partner, an important partner, particularly in promoting the use of iodized salt to prevent iodine deficiency. This also links to the Republic Act 10611, which is the Food Safety Act of 2013, which calls for schools and food service providers to follow food safety regulations. And we also have the Republic Act 11358, or the National Vision Screening Act, which provides school-based vision screening for kindergarten and the referral of children identified with visual problems. And of course, the recent one, Republic Act 7624, which is the drug education law, which integrates within the education about the ill effects of drug dependency, addiction, and drug abuse into the curricula of schools. So when we try to understand these laws, new programs and revisions can always go back to the principles behind these laws and policies to help them adapt new interventions to the main context or the main motivations of these health policies, while making sure that the interventions that they produce are suiting the current context or the present challenges of the school health system. Now we move on to specific public health measures and programs in schools. So just to understand further, the existing measures that are already in place have had demonstrations of effectivity and are also being continued and being evolved by schools at the national level and even within the local school level. So first among these public health measures is WASH, or the Water, Sanitation, and Hygiene. So this is supported by the Presidential Decree 856, or the Code on Sanitation of the Philippines. And this is further enhanced by the Department of Education Department Order 2016 number 10, which is the Comprehensive Water, Sanitation, and Hygiene in Schools, or WINS, which talks about 6 target areas, specifically water, sanitation, hygiene, health education, deworming, and of course, capacity building. And of course, we also are familiar with the public health measure on nutrition. So schools are participants to the second SDG, or Sustainable Development Goal, which aims to for zero hunger, or averting malnutrition and promoting food security. So among the programs within schools that try to address this are school-based feeding programs, food fortification or FDA-approved drinks and snacks, and micronutrient supplementation like iron folic supplements, and the regular anthropometric measurements to identify the status of nutrition of children, and also programs like the Gulayan sa Paaralan. Another public health measure within schools are the disaster risk reduction and management programs, which considers communities' participation in risk reduction prior to the onset of natural and man-made disasters, and the continuity of the services of schools as part of disaster response and subsequent rehabilitation. So from a school perspective, this entails the promotion of behaviors relating to preparedness, as well as responding to students' immediate needs in the aftermath of disasters, and also including the physical needs, such as nutrition, shelter, and also the provision of continuing learning and psychosocial support. So some of the programs that we have: student awareness programs, and of course, the very famous earthquake and fire drills and simulations, and also having emergency kits and go bags within schools, and emergency feeding for students, and the training of school personnel on psychological first aid, among others. There's also the school health program that talks about the important role of primary prevention of conditions that may lead to disability, and the provision of medical care and nutrition services for these people with disability. So we are, of course, familiar with the special education program, which deals with assessment, group or one-on-one teaching, itinerant teaching at home, and the integration and mainstreaming of students with disabilities or learning disabilities. There's also those range of screening programs like vision screening, which is important for ensuring and maximizing the learning experience of any student, whether they have disabilities or not. Another public health measure that is present within schools are safety, first aid, and injury prevention. So since violence and road accidents are among the leading causes of morbidity and mortality among students, schools must come up with programs, directives, and approaches to protect pupils from these threats. Initiatives for this include continuing education for the school health personnel, teachers, and staff in the form of webinars on safety, first aid, and injury prevention, and the integration of these subject areas in specialized tracks, such as the sports track for SHS. Another program is oral health. So the oral health program has been extant since 1963. So it's really, I don't know, it's really been there for a while. And it was promulgated under the Republic Act 3814. So the implementation of oral health programs have been reaffirmed as well by the Department of Health through its Administrative Order 2007-0007 and the subsequent DepEd orders on school oral health programs. So these oral health programs cover a wide range of preventive and promotive, as well as screening and therapeutic services for students. So this includes lifestyle advice, toothbrush drills, annual oral exam, fluoride application, pit and fissure sealant and prophylaxis, and of course, treatment and referral of patients with oral health conditions. And last but not the least, it's important as well to highlight the public health measure dealing with mental health. So the Mental Health Act, or the RA 11036, emphasizes that mental health promotion should be in settings such as schools. So under this act, age-appropriate mental health content must be integrated within the school curriculum, and basic mental health support services must be available, and a referral system must be set up within schools. So we've had a range of programs in the schools within the Philippines, which is TALA for elementary students, which is Tuklasin, Alamin, Likain, at Alalahanin. And of course, the OKKK Tambayan, or the Online Kahusayan at Katatagan ng mga kabataan, which are the programs for secondary students, and also the Kakaibayanihan, and the Tayo Naman, or Tulong, Alaga, Yakap at Oras para sa mga tagapagtaguyod ng edukasyon, which are provided for special education students. So, I have presented to you a range of lessons looking at the policies and also the programs or public health measures within schools. So, key lessons is that there are a range of common conditions in schools that are recognized and are being addressed by the Department of Education and each of the school health system. And there are several national policies for public health that have formed the backbone for program creation and implementation to improve school health. And among the key areas for school interventions include water, sanitation, and hygiene, nutrition, disaster risk reduction and management, persons with disability, injury prevention, mental health, oral health, sexual and reproductive health, and of course, new programs apart from these can always refer to the established laws and policies as guiding principles for the implementation, and they can always adapt new strategies to suit the ever-evolving context of public health within the school health system. And that's it for Lecture 2. Thank you for listening.